And then we'll start with some introductions for the ECHO team. Renee, would you mind introducing yourself?
Sure. Renee Bolio Banks, Indigenous Cause, Jagadashimang, Zibikwe Indigenous, Indigo, Zaga Squad Jamaica, Gandun Japan, Magazine, and Judah. I'm the elder in residence at NACC. I've been here for about almost 5 years. I do spiritual care and some other healings modalities. Um, but thank you for having me here and for doing the blessing. It's an honor.
Which, and Dr. Robbie?
Yes, hello, my name is Kari Robbie. I'm the medical officer here at NACC. Also been involved in the MAT program since 2016. I've been here for, I believe, since 2011.
And I'm Lindsay King Cooney. I am the harm reduction coordinator here at NACC. And then we also have Nikki Jardina, who's the infectious disease care coordinator, who couldn't make it today. We'll move on to some announcements. I'm going to share my screen. Too many windows open. All right. So welcome, we're the Midwest Tribal ECHO Opioid Use Disorder Education and Treatment Series. Today we have Mo Mike joining us. He's the patient navigator here at NACC, and talking to us about harm reduction is traditional. A little bit about NACC. So we are an FQHC located in the heart of the South Minneapolis urban indigenous community. We were established in 2003. We offer a variety of services from primary care, dental. We have an IOP department, lots of harm reduction services, and we have an MAT program. This is a list of all the current open positions at NACC. Our website is down at the bottom, so feel free to visit the website and you can read about these job descriptions. Some session guidelines. Please know protected health information. If you can mute yourself. If you're feeling up for it, it's always great to see faces, just to be engaged a little bit more. Please let us know who you are in the chat. So your name, title, organization, and email. I can send you out information, the post-evaluation survey and such. Some announcements. So we have upcoming echoes on April 17th. We have what is perinatal harm reduction. And then on May 1st, we have gender medicine. This is a list of other echoes that we recommend that cover topics surrounding OUD as well. Feel free to reach out if you want more information on those. And then we do offer continuing education credit for those who are eligible. We just ask that you fill out the post-evaluation survey to receive the credit. And I will put that survey in the chat today as well for your reference. And then finally, case presentations, they make for great discussion. So if you do have one to present, please let me know. My email address is at the bottom there. And I think that's it for me. So I will hand it off to our presenter today, Mo. Welcome.
Hi, everyone. My name is Mo Mike. I'm a patient navigator here at NACC. I started working here October 31st of 2022, and I'm Cree from Beardies and Okamasas Cree Nation, up in Treaty 6 territory, Canada. I ended up here by way of prayer and found a place to stay, and I got my recovery here in Minneapolis like 20 some years ago, is when I started my recovery journey. So the first time I heard about these 7 grandfather teachings, and it was framed exactly like this, harm reduction is traditional. I heard it at an HIV conference in 2016 in Canada, and so I was intrigued, and they shared about how they did outreach, and um you know and as they were talking, I was like, wait, I do that, wait, I do that, wait, I do that, like, so I was really intrigued that the way that I approached people was a part of teachings. And it was these teachings, the seven grandfather teachings. There's a slide, as you can see, with all of the words on it, of love, respect, bravery, honesty, humility, truth, wisdom. And I didn't come up with this concept on my own, but I just it was always in the back of my mind. And then one day I went to an opioid use meeting here in the cities, to see how could we navigate this epidemic of opioid use that was happening in the city. And I was a little bit shocked at the things that I heard in terms of, like, the people that we serve and the people that are using opioids. And they were saying things like they're bringing um, criminality to the neighborhood. Uh, you know, they're using their bodies for this and that. And I was like, um, I came here 20 some years ago to Minneapolis, and I would walk from, you know, across the 35W to here to this area every single day where NACC is. And there was the same thing happening 20 years ago as there is today. So it made me feel kind of a little bit disgruntled that they were talking about our relatives in such a disrespectful manner. And especially for people who had the teachings of maybe they're sun dancers, maybe they're Medewan, maybe they're that, and the way that they talked about our relatives, um, and I didn't like it. So I remembered this harm reduction is traditional um, teachings that I had heard, at this HIV conference. And so I decided that I wanted to make a presentation about it, because one of the things that the way that I live my life is through these teachings. And at first, like I've always had love. I don't hate people, I love people. And so, like, that was the beginning of my, started to put my foundation on these grandfather teachings. But these grandfather teachings really taught me how to treat myself and treat other people. Um, I grew up in a lot of different ways. I grew up in the church. I grew up in various places. And regardless of, like, they would say that they were these upright people, but then I'd see the way the way that they would treat other people, and I'd be like, okay, I don't want to live like that. And that's the way I felt about learning that these elders were talking about are people that are hurting on the streets, that are in a cycle that is hard to get out of once you're in there. And that's being unsheltered, that's a hard place to be. Um, and so I really feel like this um topic was about teaching the people that we got to look through people through these lenses, you know. And so if you're respecting another person, you're going to look at them, right where they're at, right where they're at, and allow them to be who they are. And you're treating them with love, you know. So you're treating a person with love. You're not hating on them. So you're not spewing things that are homophobic or racist or classist. Um, you know, respect, respecting that people have their own choices, and sometimes this is where people end up with their choices. Respecting their own, respecting their autonomy to be who they are, you know, because we don't know the story behind anybody else unless they tell it to us. And that's what I've learned, you know, like when I've learned the stories of people doing outreach, I learned that a lot of people were artists, powwow dancers. Um, you know, they grew up with their grandma. They really know how to um, take care of each other because of those kinds of things. You know, you wouldn't know that if you didn't talk with folks. Um, and you know, when I first started working on, I've always been kind of pretty truthful, but I never been really brave, you know. So like, I used to live in a lot of fear. I grew up with fear my whole life, so I really always had a hard time speaking my truth. So if somebody was being mean to one of my friends back, you know, 30, 40 years ago, when I was still young, I wouldn't stand up for them because I was too scared. And even though I knew that the other people was wrong in the way that they were treating my friend, I would still not stand up because I was too scared. Today, if somebody's mistreating somebody, I call it out. You know, I'm not afraid because I know the truth um is better. Even like say if someone came up to me and said, you know, and they were swearing and being mad when I'm providing a service, you know, instead of being punitive and say like you know, you can't come back for a week, you can't come back for a month, you know, ask them a few questions, open-ended questions, you know, like, you know, what's going on with you? Mm, You know, are you all right? What, you know, like, tell me what's happening. Because often people are maybe in a place where they just found out someone died. They are sick because their body needs the drug that they've been using and they haven't had any for a while and they're getting sick. And so maybe you're offering them syringes and they don't have any, so they want to get it so that they can go get well, you know, or, you know, we never know. Maybe they know that they haven't bathed for 3 days and they feel really cruddy and they don't like the way they feel. You know, there's a lot of different reasons why people are upset. And we got to remember trauma-informed care as a part of these teachings. We got to remember that everybody has a story. And when we start looking at people with humility, we're gonna get to learn those spaces with them, because when we look through humility, we're not being arrogant, we're not being pious and uptight. Uh, we are approaching them in a way where it's gentle, where it's kind, where there's compassion. And that's, you know, those other values that stem out from humility. When you start living with these teachings, you have a lot more integrity. And people who want to live with integrity, you know, don't like to lie, don't like to put people down, um, and lived with wisdom, you know. Wisdom is like not using your tone of voice, like say somebody came and asked you for syringes and you're like, you know, what are you going to do with it? You know, that's not an appropriate response to that. We already know that they're going to use it for something, uh, probably for drugs. We already know that they have a use for it. We don't have to shame them for that use, because they're going to do it that way, and they won't come back to you and respect you and want to deal with you if you're treating them in a way that is off-putting. And if anybody treated me that way, I wouldn't want to go back to them either. You know, it's hard to do. Um, I've witnessed people getting punitive measures, and it's not helping someone who needs our help, like, you can be honest. You can be honest and say, hey, I don't deserve your disrespect. Part of these values is respect, to honor all the creation, so we're honoring them, honoring ourselves. We can say, hey, you don't get to treat me that way. Um, if something's going on with you, tell me about it, but don't treat me this way. When we look at speaking truth, that's a part of this. You can speak your truth with bravery and say those things. People who you are more direct with, regardless of who you are, they have more respect for you in the future because you respected them to be truthful, to be honest, and say, hey, you know, this is just the way that we can deal with people without um, putting them away from our services. And if they are being really super disrespectful, um, give them what they need and move on, or else say, like step out of line for a while, and um, when you can calm yourself down and allow yourself some space so that you're not so angry, upset with me, come back. Because I do want to deal with you, like this service is for you, it's not for me. And, we also got to remember in this to, like there are some days where I'd be like, I'm sorry, I'm short. I've been having my own stressful day, and I've had to own up to my own behavior to a client or to a peer, and say, hey, I'm sorry, like I was short with you and I don't want to be, and I apologize. And like, can we move on from this? And, I made good rapport with my clients by owning up to when I am not in the place. And often I do that even before, like, I'm like, if I seem kind of off, it's because I am. And the people that I see regularly, they understood it because they get there too, and I'm just really thankful um for the work and for the people that that I see every day that trust me. And I don't think that I would have earned that if I didn't use these principles. Loving another person right where they're at, showing them respect. You know, we don't lie to people and say, hey, like we can do this and this for you if we can't. Um, we just be honest. Like if they ask for, hey, do you got any gauze and stuff? I got an abscess, and you see their abscess and it's red and swollen. You say, well, first of all, I think that you should go see medical attention immediately because that looks infected. And, infections, if they get worse, they could cause someone to get sepsis and die. And so like those are the kinds of things where we want to be really careful. Or else if we see that it's going away, and like we could offer them the stuff and like still seek medical attention, always do that, because regardless, you may be helping them save their life. um you know like there's some people that I know have shown up at places where their ulcers are so severe that like you could see their bone, and they're still trying not to go see the doctor, because they don't want to because of the way they get treated. You know, they'd rather put up with that pain and that than see the doctor because they don't treat them with respect. You know, they don't they don't show any wisdom in how to approach a person who's hurting. You know, they're just like they're doing their job. Um, and that isn't right. Um, I'm just thinking about the way that I've used these in my life, you know, like so learning how to be brave um has been a really hard one like my whole life. And so I started with this actual harm reduction is traditional. The way that it's traditional is like learning how to, when you look through the lens of these, you can see a human. You know, you see a human before you. Um, you're not looking through the lens of hate, um, or disrespect, or fear, or arrogance, or even ignorance or foolish thoughts. You know, you're looking at them as a person. Then, you know, you're looking at you know, I'm looking at Lindsay right now on the opposite end of this. And and I'm really thankful for that. I'm getting a little off topic here because I'm a little bit shy about it, but um you know, I just want people to understand that the people that we serve have feelings, have needs, um, are are here for the services, and that when we treat them with these teachings, we're going to help them transform their own thoughts about themselves. We're there to, you know, allow them to stand up a little bit higher in who they are. You know, regardless if we use drugs or not, we still deserve all the same um love and respect and kindness as anybody else. And I've used before and I've dabbled in a lot of different things. And I don't think that just because I haven't used erratically that I should be treated just to say treated worse than anybody else that or treated better than someone that uses erratically. You know, the reason they got to that point is doesn't matter. They're right there right now. So to shame them for that use is not even beneficial, you know. So allowing them the opportunity to harm reduction, you know, came about in terms of HIV, Hep C, bloodborne pathogens. So they're like, you know, regardless, they're already using that. So let's give them the tools to keep them safe, because maybe one day they'll decide, hey, you know, I'm tired of this life. Let me, you know, I want to make a change, and they start to do that. And if we treat them with these teachings, they're going to want to come to us and talk about it and actually like, hey, trust us to help them to the next step. You know, if they don't have no trust and respect for this, they're never going to come and ask us to go to treatment or to get medically assisted treatment or MOUT, um, or any kind of help like that. You know, they they're just going to be silent. And I've seen that happen, you know, like uh where I used to work at, my clients told me that I was the only one that ever talked with them. And I'm like, uh I was sad about that because like we should all be talking with our clients. You know, the more that we get to know our clients, the more that they get to allow themselves to be real, the more that they'll um, be there, like uh, to to support you. I used to work at the navigation center back in 2018, and because I live these values and because I treated the people in my tent with respect. You know, I'd leave my phone on my desk and I'd go and do things for people, you know, like get their some lunch, and put them in their pods where their clothing was and stuff like that. And they were like, anytime a person from my tent seen my phone, they'd pick it up and they'd bring it to me because they had respect for me. And they said, don't leave this laying around like that. Someone's gonna take it. And um if I didn't treat them with respect like that, it would have already been gone. And the whole time that I was there, I would do that often, and they always brought it to me. Someone else brought it to me from my tent, and then it didn't matter who. There was about 5 times, and all 5 different people. So, it goes to show how much respect, because they were stealing things left and right everywhere else, you know. But because I showed them respect, they showed me respect back. And, you know, that's a real how come you're coming into the room again, Lindsay?
I
Anyways.
was, yeah, no idea. Sorry about that.
All right. Anyways, um, I feel like I'm going in circles. Um, Maybe you guys have some specific questions that y'all have, so that way, we can, um, I can share more stories of how I use this in my life. But if people have questions about how to use them in specific instances, I can maybe help you with that.
Maybe I'll stop sharing my screen so that we can see everybody. Is that okay, Mo?
Mm-hmm.
Does anybody have anything they want to share or any questions?
I just want to say that I agree with Mo. You know, like if you can build the respect and rapport with clients, you'll definitely know, you know, it's really important to treat everybody with dignity and, you know, get to know people, not just hand them something and take off. You know, it's relationship building. And then people trust us when they need something or want to make a change, like Mo said.
Usually I talk way lots more. I've been kind of nervous about this for a little bit. Uh, I haven't talked about this in a while. I haven't did street outreach in a long time. Um, and so, but I work in the medically assisted treatment side of our clinic. And so I have clients here that I have built rapport and trust with. And, you know, they come and sit in my office and come and talk with me. I'm not a counselor by any means. But I just listen and I just share from my own experiences because that's all I can do. Um, you know, I'm really honest about things like so. If they come in and talk about domestic violence, I share my story. I share how I was on both sides of it. You know, um I was a survivor of it as well as, you know, I got involved in family violence, and that is a hard place to be, but I was there. And but I'm able to talk about how I felt in that time. And when I talk about the way that I felt when I was the aggressor in that, and like some of the things that have popped up and the people that have been aggressors as well that have come into my offices, um, and that I talked with about this, they understand those feelings and it helps it to open up a little more to share, hey, you know, someone else knows what's going on inside when I'm doing this. Cause like when I did it, um, when I remember my violent acts, I um I remember the first time when I was, involved in that. It was because I didn't have integrity. I was lying about who I was. I was feigning that I was a traditional person and I wasn't. And I got with a traditional cultural person, and it didn't work out too well because I wasn't in the same space of being as they were, and I kept feeling inferior, and instead of talking about it, I was taking it out on that person. I felt like not good enough. I felt so many different things that I didn't understand, but sharing these truths helped me to reach people, you know, um, sharing the struggle of post-acute withdrawal syndrome with people that are between a year and 18 months. I remember those times when, like you're all of a sudden you're wanting to use again and you don't know why you're getting all these feelings. It's because um for me, I found that it was because you're at your next step of healing. You're at your next step of being where you're at. So like using these values of being truthful, being honest, and being brave about just sharing these things have helped me to connect with folks that are generally people have a hard time connecting with, So like for instance, um having someone with violence tendencies have come into our space this year, and I'd always be the one that was able to talk with them and hear them and like allow them their emotions. And they were never violent with me. They never, disrespected me, was swearing at me and stuff like that. And they were always um glad to see me. But yet they didn't have that relationship with other people. They were always like already like putting on their armor, so to speak, of this is who I am. And so, but with me, they let that armor go. And so like those are the kinds of things that can happen if you see past um their armor. Because, people puffing up and being all like that is a defense to show that they're not hurting. I mean, to keep from being hurt and to keep you away from touching those things that already hurt. And I know because I was there, and I learned that in treatment because one day I was like all acting like that, and my counselor said, "Mo, what are you working on?" And I was working on my issues with my dad. And my had all my life had my dad on a pedestal. And when I looked at my dad, I had a hard time seeing my dad taken from his pedestal to realize that he had beat my mom, because I saw it. And he was a womanizer. Um, he was a drunk when I was young. And like to have those with my idealized um idea of who my dad was, because he wasn't that to me, but it was still a part of who he was. And I couldn't rectify those. And so I was hurting. I was hurting because I had to take a look at that. And a lot of times people have more things to look at than we realize. And I always suggest therapy, EMDR, with folks, because a lot of us have gone through so much trauma that EMDR will help us to alleviate some of those triggers that we have. And, you know, I just be truthful about that too, like how EMDR helped me to change triggers. And how I no longer have the same triggers as I once did, you know, that will make me act out. And I can act out just like anybody else. But because I understand where those stem from, and I understand how they had made me behave in the past, that I no longer have those same responses or reactions. And, you know, that's because I follow these tenets again, ways of living, you know. It helps me to see the truth in myself. It helps me to be honest with myself. Okay, this is still what I need to work on. If I got a trigger, I work on it. I don't just let it be. I can't, because I want to be continue to grow. I don't want to just be in a stagnant place. And that's what these seven grandfather teachings really teach me, how to be a person who loves everybody else. I'm not, um I don't condone actions that are violent or whatever, but at the same time, I also try to look at the human behind it, because often people who do harmful things have been harmed in some way. And if we can heal some of those harms, then they're not going to react the same way. They're not going to respond the same way. Because I know, because I was there, I did harmful things. You know, I used my fists on somebody, and I'm not proud of it, but I did. And I don't do that anymore. Because I fixed those triggers. I went to therapy. I did EMDR around it. I really worked at it. And I think that when we use these in harm reduction is traditional, you know. Harm reduction is about reducing the harms. And so when we use these, we're reducing the harms to people. You know, we're not treating them with lies and dishonesty. We're not disrespecting them, you know, because how could you have disrespect living with respect? How can you have lies living with truth, you know? And so that's, like, uh, I may be someone who, is a little off center or whatever. And, I don't work within the boundaries of, um, what is said that we should, I really allow for myself to extend myself, and I always look at intent. So if I'm going to give a $25 gift card out of my pocket for groceries, my intent is, to make sure that they have food for the weekend. Okay. But if I had uh um my intent is always to make sure that it's all about the client, because I work in a client-centered way. So if the intent is to make me feel better, then I don't do it, whatever it may be, you know. But if it's to help the client, and it's legal, it's bound by a different, I don't know. I work outside the box a lot. I just can't explain it other than that. Um I you know I don't give rides in my car. I don't, but I'll ride the bus with someone. I'll ride in an Uber with someone. I don't, in this line of work, nobody who knows where I live. Um And I'm really glad I don't live South Side right now, because I know that if people knew where I lived in South Side, that I would have knocks saying, "Hey Mo, you got any syringes?" And it would come at all different times of the night. because they would know that I'd probably say, yeah. So I'm thankful that I don't got to deal with that. One of my friends has had to deal with that, so they had to stop being um, that person who had syringes because they had way too many people coming to their house because they knew where they lived. Um,
Hey, Mo,
but yeah,
there's a couple of questions. Brian, sorry to interrupt you.
oh, that's fine.
I didn't mean to, it's hard to jump in, but Brian, did you have, I know you had your hand up for a while. Did you want to share something?
Oh yeah, can you hear me?
Yep.
Yep.
Oh yeah, hey, good to see you, Mo. Been a while.
Hey,
Yeah. I'm glad you're sharing this, like the harm reduction's a big topic, in the healthcare systems and the programs and the community. A lot of people bring it up, talk about it. Some people don't really understand what it means, and don't understand why, these certain things are happening. Think they understand that the people in the community need help. And we had a program called the Seven Sacred Branches, which is from the seven grandmother teachings that you're talking about. And it was really successful. We had it through SAMHSA grant, and then it was for a couple of years, and it was real successful talking about those different teachings and the meanings behind them, and then the animals that go with them, because there's animals that symbolize those different
yep,
ones, and they all kind of relate back to the medicine wheel. And then like yeah, so somebody said something about 7 generations, how those we have those different numbers, four directions, those 7 directions, those different teachings that we have that they're really old, they're ancient. And what you're talking about, you said you feel like you're going in a circle, and you said that, I was like, cool, that's the way we're supposed to go. That circle is part of our journey, our life. And I think once people start to relate, these teachings that you're talking about and how we can implement them as a clinic, as a program, like that those values and those teachings are important. A lot of people get away from those when they start having addiction and struggles in life, trauma, um, all these, even just their healthcare, there's their physical health, they get away from these teachings of being connected to the community, connected to their own wellness, and so they get away from it. And so you kind of bringing it back to that this is traditional and it can relate to these ancient teachings that we have is really important. Like I think it made me really happy to see IHS and the programs and clinics, tribes, embracing the traditional cultural knowledge, culturally rooted knowledge into our behavioral health, mental health, just healthcare in general. After so long, because I was doing this for probably like over 20 years, coming like 25 years doing this kind of work, but there was no funding for it hardly. You had to get funded through another way, suicide prevention or some other way, drug and alcohol prevention, to bring these cultural teachings in. Music, there's different ways that I found to be able to share the message, that you're talking about, these teachings, and that through those different outlets, and so, and finally, the clinical care and traditional knowledge was kind of embraced, through IHS, and I think it was 2017, 18 when I started seeing conferences and stuff like that, and how they're working together. And here we are, COVID kind of set it back a little bit, but kind of brought us to those basic traditional values that we have, and I think that's really important right now, because we need anything that's going to help the community or help somebody, with their physical, mental, emotional, spiritual health, is good. So I was glad to see this. I kind of just barely saw this the last couple of days, so I was glad that I saw it and was able to get on today. Just wanted to let you know.
all right, thank you. I
Hey,
appreciate it.
Thank you. There's a couple things in the chat. Bobby had a question for you, Mo. Can Mo speak to the correlation between the 7 grandfathers versus the 7 generations? How are they connected, different, interact?
Well, honestly, I cannot. I don't know much about the 7 generations teachings, and so I cannot do that, unfortunately. But it's something that that maybe I could learn about and do in the future. Sounds like a good thing to research and see how I can correlate that in my own life because I'm always up for more learning. I'm always up to, you know, um become a better person because really that's what these grandfather teachings teach me, how to be a better person, how to approach another person, even someone that's different, someone that's a Republican, someone that's African American, someone that's you know straight his straight cis heterosexual, you know male, because or someone that's just different in any way. And but when you see a person for a human, then you just start to see that they have feelings, that they have a way that they were taught, that way they were brought up, just like you and me. We were all brought up in a certain way and we're expected to follow those ways, right? But and so because of those differences, like I just really feel like that we that we just have to embrace each person and be human. I really just really believe that we're all human, and you know the mistakes of our parents not teaching us to have values, rather than we have to keep up with the Joneses or whatever, gives us all of those other disrespect, lies, fear, all those ways of living. When if we live with these, our life is going to be so much infinitely better. And I can say that with the from the bottom of my heart, that because my life is infinitely better when I started living these teachings than when I wasn't living them. Hey, I don't know if I answered that question or not, but that's what I gotta say.
Thank you. There's a lot of great resources here that Ren put into the chat. If people want, I can email those out to you. It looks like Native Youth Sexual Health Network uses the 4 Fires model to approach harm reduction. And then First Nations Health Authority uses the animals wolf, eagle, bear, and raven to root harm reduction principles and Indigenous knowledge. Up in Coast Salish territory. I'm not familiar with that. But a couple of links there. And then it looks like Alana commented, very important to put your judgments or rude comments aside because patients, clients are hesitant as it is to ask for help with harm reduction kits, etc.
Yeah, and that's so true, just just get them and like treat them as a person that's coming for milk or cookies or you know health services, because that's what that they actually are. When people come in for syringes, they're actually making sure they're taking care of our health, you know because if they're thinking of using and they want to use and they don't have any left, they're not trying to reuse, they're trying to use a new one. That means they're thinking about their health, you know. I appreciate that. Um, I was gonna say something else. Oh yeah, thank you, Ren, for putting all of these things. And like I use these ones because I'm Cree, and all of us Algonquin have these same principles. So the Cree, the Anishinaabe, Potawatomi, these are our teachings. And I think even Micmac, I'm pretty sure Micmac's also Algonquin. But like you can use whatever teachings are from your area, from your tribe, and use them as a model of how to approach people, how to how to use them as a harm reduction tool, and that's what these values are to me. They're a harm reduction tool because they reduce the harm to another person that's seeking our help. That's predominantly it, you know? And you can be just honest with people if you can't give them what you can, and be honest about how you feel. You know, I had to one day, someone got punitive measures where I worked at, well, and because of they were raising their voice at us and stuff like that, and um they to more than just me, but the rest of the people. And I didn't like that, and I thought about it for about a week, and I was like, uh, I said, "Hey, can you all tell this person that I'm looking for them?" And within half hour, this person showed up, and I got the chance to talk with them and share, "Hey, you know, like I got to tell you that like when you're raising your voice, I start to hear wow, 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 you know, but uh if you lower your voice," and I said, "not mistreat my colleagues, you know, we'll listen to you, we'll hear you better." And I said, "You know, I have triggers around loud voices." I said, and those like I still get that where I'm like, and I feel a little fearful, like a deer in headlights. And so I just shared that with him, the truth of that. And we got through it, and they started coming again, and they no longer treated um the other colleagues that came to the door with disrespect, you know. They because I treated them with respect and invited them in to talk about this. You know, we didn't we came to an agreement. And if I hadn't done that, I would have, you know, what knows what happened with that person. I don't know. But I was the one who had to take responsibility for that, because I didn't want him to get punitive measures like that, because you know, we're there to provide them a service, not the other way around. Anyways, that's what I gotta say about that.
There's another comment, Mo, from Elise. Traditional culture and values are so important for helping our teens who are subjected to constant social media, TV, and school pressures to be arrogant, rich, mean, unkind, materialistic, sexual, and get high. Love hearing how you approach people.
Thank you. I appreciate that. And it's so true. I mean, like, um, I have people who are friends that other people would be like, how come you're friends with that person? And but they don't know underneath their grouchiness, underneath their use of their voice, that they actually have a lot of good things inside of them. And we wouldn't know that if we didn't connect.
Thank you so much. We have about a minute left. Any final thoughts?
I really hope that all of you can, you know, remember to use some values like these in your work, and see what changes happen if you don't already use these. You know, if you start to change something that you notice in yourself, help other people um, to take a look at this with themselves as well. All right, that's what I gotta say.
All right. Miigwech. I love hearing that talk. And yeah, this was great and great discussion, everyone. Thanks for being here, and we'll hope to see you next time on the 17th. Have a great day.